or by raising your hands, and we will triage them, and we will do our best to cover them all. Uh, Also, this is for regarding today. And in the end, also, if you have any questions, just either write them in the chat or raise your hand. Uh, and I will also emphasize on the point of the certificates that was what are the rules for the certificate of this course. You should attend at least 80% of this course, meaning now we have 5 modules. You should attend 4 of 5 modules, plus you have to, by filling the feedback forms that will be at the end of each session. So I am encourage you to stay to the end to receive your feedback and to fill it. And thank you. And now, Dr. Shakir will start the lecture. Thank you.
Hello, everyone. Can you hear me?
Yes, doctor, we can hear you.
Thank you, Dr. Mustafa, and thank you for everybody to join the second module in our series of modules constitute the project of research and publication. As Mustafa said, we will have the first lecture in this module. Actually, it is a one lecture, but we are going to break it into 2 parts. The first part, the lecture would be about, can you see the slides?
Yes, doctor, it's clear.
Oh. The lectures would be under the title of How to Write a Research Protocol. The part 1 will be covered in the first half, and the second will be in the second one. The aim of this lecture would be to define what is research and then what is a research protocol. Of course, I would like to say something because few of the audience cannot speak Arabic very well. They asked me to speak as much as possible in English. So the core of my lecture, as you can see, the slides are in English totally, and the core of the lecture would be as well in English. And probably I'm going to emphasize on a few points in Arabic. What is a research protocol, and then what are the steps in writing a protocol? If we ask what is research, actually the research can be, the definition of research can be made after answering these questions. What is research? Research is collection, arrangement, presentation, analysis, and interpretation of data. But this is not enough. We should know how to do these, and the answer of how is systematic. If we do a research in a systematic way, this is research. Otherwise, the result would be inaccurate. And of course, we should not forget always that whenever you are doing a research, you are aiming at solving a problem, a health problem. And you may remember from our previous module, we talked about evidence-based medicine, and the pillars constitute evidence-based medicine. And we said that one of the most important pillar is best available research, best available knowledge or evidence, which should be taken from a research. But which research? The research which is good. And in order for a research to be good, it should avoid or eliminate any biases, chance, and confounders. And how to avoid these, I call it enemies. The best way is to write a plan. It's always writing a plan for anything in our life is the parallel to success. So if we want our research to be a successful steps in evidence-based medicine, we should write a good research protocol. So research protocol is a systematic steps written in advance, and this is very important. It should be written in advance that the researcher is going to follow in performing a research. And why we are doing this, of course, to avoid any potential faults. It would be logic to say, if I ask this question, why we should write a research protocol, the answer, or the first important answer, is to avoid any potential faults. But remember, you have many other causes for writing a research protocol. To gain an approval from the IRB, Institutional Review Board, or research committees. Nowadays, you are not allowed to do any research in the world without having approval from the research committee. Even in Iraq, each directorate of health in Iraqi provinces has its own research committee, and you have to apply a research to have their approval. Of course, to gain fund is another important. Even in well-developed countries, even in rich countries, researchers have the responsibility to get a fund if the research is aiming to improve or to provide a big or to answer a big question. Of course, to register the study, you may remember in my talk last module, in order to avoid publication bias, there is a committee enforced researchers to register their study in advance. So all these things are the benefit of writing a research protocol. Before I go through the steps of writing a research protocol, I would like to say a few points. The first point is that if you go into the literature and sites, you can see a research protocol written in probably different steps. Omit some of my steps, combine some of them, and add another. But believe me, these are the most vital and important steps which is required in any research protocol. Whenever you write a research protocol, these are the essential steps. So I omit other steps from this lecture. The second is to say that this is the research protocol required whenever you are doing a health or medical research. Probably our colleagues from other domain of science have their own way of writing a research protocol. So the first step is to have a title for your research to call it for. Probably this is not so much important comparing to other steps, but it is wise to mention a title for our research. The second step is to write an introduction and references. The third is to write the research question, and this is the vital part of research protocol. Then research hypothesis and objective, right? Objective of the study. Now, the heart of any research protocol is the methodology and should constitute of choosing the study design, define the cases of enrollment and exclusion criteria, define sampling, randomization, and the blinding if they are relevant to our design, outcomes, and analysis of data. This is the core of methodology. We should not forget to write the intervention or the procedure we are following. Of course, here we are not aiming at writing the intervention and the procedure like the surgical intervention. No, we should write the procedure of the study. For example, we are going to split the groups into two, the participant into two groups according to these criteria. The first group will have this, the second will have that, and so on. We should not forget also the resources. Doing a research is a human effort, is money, and it is a time. So you should write the plan of these in details. The final and the other most important part of research protocol is to write the ethical consideration. Of course, part of these will be talking about in the first lecture, this one, and the second will be deferred to the next session. Research title, I'll not go to talk so much. It is very simple. It is just a name to denote a research, like, for example, dexamethasone in hospitalized patient with COVID-19. طبعا راح نسمع التايتل in two different things. الأولى هي when we are aiming to write a research protocol. The second when we write an article to be published in a medical journal. And I will talk about this in the fifth module, inshallah. The important topic, introduction and references. Why we have to write introduction? What are the aims of writing introduction in a research protocol? The first thing is to prepare the minds of the reader, who later on the reviewers in medical journal when you apply an article, about your research question. Of course, we will have an example, and we will apply these consideration in the example. The second point is to write what is known in the literature about your research question. So you will have to do a literature review and to see what the literature has about your research question. The rationale of choosing this study, why you choose this topic, not that one. This is very important, and I will explain what does the rationale mean. Of course, any other relevant knowledge you find it of significant to be written. After that, I should have a list of the references, because in writing any introduction, you don't have to write your opinion. You should reference and cite any piece of knowledge written. خلي نشوف this example that we are going to نعتبره الموديل during talk about our subject. Is dexamethasone more effective comparing to usual treatment for hospitalized patient with COVID-19? Of course, this is taken from a famous study published in the New England Journal of Medicine, where this is the study اللي اعتمدت as a part of evidence-based medicine will earn a recommendation to use dexamethasone for hospitalized patient with COVID is based on the result of this study. طبعا I advise you to go through this literature, through this article, and you can download it, and to read the introduction. It is very well written. So I'm going to show you part of the part of the paragraphs and why the author write these paragraphs. The first paragraph, this paragraph 1, is some introductory notes about what is corona or COVID-19, and something about the diversity of symptoms from being asymptomatic till severe respiratory failure with the need of ventilatory support. And this is, of course, the research background. The second paragraph, what is done in the literature about research, as far as the research is talking about case mortality rate, the author writes something about case fatality in the United Kingdom, which was 26% and 37 among those using ventilator. The third paragraph, which is going to show the scientific basis, why the author using or suggesting using dexamethasone, because a co-host immune response play a major role in the pathogenesis of organ failure, specifically the lungs. And in addition, there are markers elevated, inflammatory markers elevated in cases of severe COVID. So these things will give an idea why the author suggesting using dexamethasone in the treatment. The fourth paragraph, this is a very important paragraph because it shows the reader why doing this research is important. As you can see, the author said that based on the previous paragraph of having a relation between inflammation and severity of disease, and glucocorticoid is debatable because only small trials have using steroid. So this will give the author the right to choose this topic in order to find a solution for it. So this is the rationale. I stress on two important things whenever you are writing a research introduction. Is there any difference between introduction written in the research proposal or in research for publication? Actually, no, but in research, when you apply your article to be published in a medical journal, at the bottom of the paragraph, you should write the objective. While here in research proposal, we have the objective in a separate section. Of course, some sites or universities asked to write literature review in a separate part from the introduction. The second important point here is that you don't need to go to talk about the topic extensively. You don't need to go, as you saw in the example, you don't need to go to talk about the pathophysiology, virology of COVID, etc., because your main job is the relation between steroid and the treatment of severe cases of COVID. Research question, I will have a few slides about research question because it is very important and vital. It is the health or a problem that is a study is going to answer. It is, of course, the gap in the knowledge. Okay, it is the gap in the knowledge and the first and important step in the research protocol, and it is of course the important step that any other steps will depend on it. Later. ممكن المايك mute the mics please. السؤال الآن منين نجيب الريسيرش question هذا نحصل. The first thing is from literature. From the literature. The second is to have it based on previous research, your research. The third probably from our discussion with our mentor, our colleagues. The fourth is from attending conferences, and the fifth and the most important is from our daily practice with patients. Uh, the other topic, what is your research question about? You have to decide from the start. For example, are you going to talk about the diagnosis of something? Are you going to talk about effectiveness and risk and side effects of a treatment? Are you going to talk about the prognosis? For example, if you have patients with corona and has many comorbidity, what are the prognosis of getting severe infection, for example? You can see some of my examples are about corona because we are living in the pandemicity of corona. Of course, cost effectiveness is another domain to search for an answer, to find causes and to find a prevention. For example, the role of mask in prevention of COVID. هنا السؤال المهم, how can I make my research question a good one? I show you this statement said by Stephen Chai, one of the Nobel laureate in physics in 1997. He said that one of the most important things that a researcher does is to ask a question that is important, and this is logic, and that has a chance of being solved. So important question that that does not have a chance to be solved is not a good research question. This Stephen Halley in 2007 حط هذه الكلمة final, وراح نشوف هاي it constitutes of 5 letters, denotes of feasible. The research question should be feasible, يعني visible in relation to time, in relation to our resources, in relation to our expertise, and even to our money. The second is interesting. You should ask the question which is interesting not only to ourselves, but to the patients and health authority in general. And يكون novel, and novelty is to answer an existing gap in the knowledge. أيضا يكون ethical, مثل ما راح نشوف the effect of ethics on doing a research, were relevant to the community. These are the 4 important things to be kept in mind whenever we are attempting to write a research question. Of course, the research question should be narrow, not broad, and this is vital. Whenever you write a broad research question, it would be difficult to answer. And it would be difficult to choose the best design to answer it. So try your best to have a narrow research question. Let us examine this example. If I said my research question would be, what is the effective drug for COVID-19? Do you think that this kind of question is easy to answer? Of course, no. Because which patient with COVID my study would address? مثلا adult, children, male, female, hospitalized, non-hospitalized, patients with comorbidities or without comorbidities, etc. What type of a treatment I'll give to this patient, and comparing to what? Shall I compare it to the usual treatment? Shall I compare it with without a treatment? Of course, حتى كلمة effective, when we say effective, how you can measure effective? For example, by reducing mortality, or by reducing the length of stay in hospital, or the length of stay in ICU, or the need for ventilation. طبعا so different, ولذلك تحديد effectiveness is very vital. So this is a broad research question which is difficult to be answered وحتى يكون difficult to be generalizable. راح ناخذ هذا example in my talk. Is dexamethasone more effective comparing to usual treatment for hospitalized patient with COVID-19؟ مثل ما نشوف هذا طبعا هو الريسيرش كويستشن مال الارتيكل اللي شوفت لكم اياها، ومثل ما تشوفون هذا الريسيرش كويستشن if you compare it with the previous slide example, this is very narrow because going to talk about effectiveness of dexamethasone and comparing to the usual treatment in hospitalized patient with COVID-19. Of course, you can list so many examples and probably let me announce something that if you want to divide yourselves within a group and each group write a research protocol and then to have another meeting to discuss it, يعني the group present their research question and we will comment together in order to gain the benefit. I'm ready. Research question الخطوة الأولى مثل ما شفنا سابقا هو define the area that you want to study. فخلينا ناخذ مثال وهو إنه what is the best mask for prevention of COVID-19. نروح نسوي literature review وهذا أيضا يقودنا إلى موضوع where to search and how to search, and probably we have a plan with أستاذ هلال to add another module to this project talking about how to do literature review because this is very vital issue in research. الخطوة الأخرى ورا ما حطينا البرود things we should sharpen our research question accordingly، يعني according للي نحصله من literature review. فمثلا بدل ما نقول ماسك نقول surgical mask مقارنة ب versus N95 for example in prevention of COVID when in healthcare providers with primary healthcare centers. صار الآن نعرف. وحتى بعد ما نخلص الريسيرش كويستشن لازم نسوي some to test its feasibility. هل okay can I do it? I have the resources to do it. Is it ethical, etc. I will skip this slide. The other thing after having a research question, we should have the research hypothesis. I will not talk extensively about hypothesis because it may be difficult for some of you, but I want to say something about hypothesis because you may encounter it. Hypothesis is a testable statement that predict relationship between the two variables. يعني مثلا بالمثال اللي احنا حاطيه طبعا اكو null hypothesis اللي هي تفترض there is no difference between two groups والalternative اللي تفترض اكو difference. طبعا بعدين according to the hypothesis ناخذ ال statistical test ونطلع ال p value. According to p value يا اما we reject null hypothesis او accept null hypothesis. I don't want you to bother yourself much with hypothesis, but I put it here just to remind you that there is something here. الاكزامبل مالتنا الدكساميثازون more effective إذا أريد نبني عليه hypothesis فالnull hypothesis تقول there is no difference in mortality rate between hospitalized patients using dexamethasone comparing to using usual treatment. طبعا نكمل الباقي باختيار التست إلى آخره. الريسيرش اوبجكتيف الحقيقة هواية يخلط بين الريسيرش كويستشن والريسيرش اوبجكتيف. when we are writing a research to be published in a medical journal احنا نكتبه once for both of them. The difference is very simple. The study objective is an active statement about how the study is going to answer a specific question. خلينا نرجع إلى المثال مالتنا ونشوف. المثال يقول is dexamethasone more effective comparing to usual treatment for hospitalized patient with COVID. هذا هو الريسيرش question. من نريد نطلع من الريسيرش objective راح يصير هو الإجابة على effective how. فتشوف الأوبجكتيف راح تكون this study مثل ما قلنا active statement يعني مو answer. This study is going to measure the effectiveness of dexamethasone in reducing mortality for hospitalized patients with COVID-19. فإذا how our study going to test the effectiveness of dexamethasone by reducing or to test the reducing mortality for those who are using the treatment. السكست ستيب هي الميثودولوجي، وهذا اهم موضوع بالريسيرش كويستشن، لانه الاشياء الانترودكتوري الخمسه اهم واحد بيهم هو كان الريسيرش كويستشن، الان الميثودولوجي. اول خطوه بالميثودولوجي هو to have study design. I should remind you that the next module will be about will include, of course, two lectures. The first lecture will be allocated for study design. لذلك I will not going to talk about study design in details. بس اللي أريد أقوله إنه research design is the set of methods and the procedures used in collecting, analyzing data in order to answer a health problem. اكو 3 جروبس نمر لهن على السريع اللي هي الديسكريبتيف ستاديز، اوبزرفيشنال والاكسبيرمنتال. الديسكريبتيف لايك كيس سيريز، كيس ريبورتس. الاوبزرفيشنال عندنا الكيس كنترول والاناليتيك كروس سكشنال والكوهورت. Don't bother yourself so much, we will talk about these later on. طبعا الانترفنشن هو الراندومايز. هذا الدايجرام ايضا يسهل لكم فهم الموضوع بالنسبه للكلاسيفيكيشن. عندنا انت either you see and describe and this is descriptive, either you see and compare يعني you see and send what you are what you see to the mind in order to compare، وهذا هو الobservation. الانترفنشن من اسمه you will intervene and to measure the effect of your intervention. الشيء اللي لازم نعرفه انه الديسكريبتيف ستادي عاده ما بي ريسيرش كويستشن اور hypothesis and there is no need to have a control group. بينما الاوبزرفيشنال والاكسبيرمنتال لازم عند ريسيرش كويستشن، hypothesis وكنترول جروب. وطبعا لما نقول كنترول جروب وعندنا numbers taken from this group and that group, we have to calculate p-value to test its significance. هذا ايضا دايجرام تقريبا يقسم لكم التايبس اوف ريسيرش ستدي. هذه معلومه I mentioned it in my last lecture in the previous module اللي هي level of evidence. And you can see here, just we want to say that according to study design, the level of evidence is different. دوما randomized controlled trials has a level of evidence higher than cohort, واللي هو بدورة higher than case control and so on. هنا دوما واحد may ask a logical question. If it has a different level of evidence, why we don't do the best one? Of course, the answer is simple because مثلا randomized controlled trials تحتاج human resources, economic resources, time sometimes limited for you. بالإضافة إلى حتى إذا توفرت الأموال والوقت والجهد البشري, ethical consideration may prevent us from doing certain study in interventional study design. Well, rarity of disease طبعا it would be very difficult to do cohort or experimental study on rare diseases. الآن احنا إذا نرجع إلى مثالنا, is dexamethasone more effective comparing to usual treatment for hospitalized patient? If we are in sitting all in a single room the answer will be for you, and you can say which study design can answer this question. Of course, I'm enforced to say the answer, which is randomized controlled trials. هذا يخلينا نعرف انه الستدي ديزاين، كل ستدي ديزاين قادر على ان يجيب شيء ولا يجيب شيء اخر. وهذا الجدول، this table is a simple table actually to guide you if you want, for example, to measure the risk, the effectiveness. A randomized with cohort is the only way to measure it. So you are not allowed to say, I am going to measure the risk of something by using, for example, case series, because this type of a study will not able you to answer this question. Methodology. الجزء الثاني بعد ما نختار الريسيرش كويستشن هو definition of the case و inclusion and exclusion criteria. What is the definition used to select your sample? هذا سؤال دوما ينسأل. يعني احنا الآن عندنا هذا المثال. Is dexamethasone more effective comparing to usual treatment for hospitalized patient with COVID-19? الآن ليش احنا مهم نحدد شنو الانرولمنت criteria for definition؟ من نجي نقول hospitalized patient with COVID-19. Any one of you can raise a question on which base you label this patient as having COVID-19. As a hospitalized patient, easy to say. But which patient? For example, احنا عندنا ممكن clinical diagnosis depends on our on the clinical features of the patient. عندنا PCR diagnosis, عندنا radiological diagnosis, عندنا immunological diagnosis. So variety. Which one of them you choose? This is very important to report it early in your research protocol. زين. ليش ال definition of enrollment مهم؟ لأن الحقيقة هو it will lead to هاي ال two terms ممكن إذا صار مجال إن شاء الله later on في next module نحكيها ال sensitivity وال specificity. But simply what does sensitivity and specificity mean? إذا أنا أخذ definition sensitivity مالته low sensitivity, this will lead to include patients who are not COVID. يعني for example, إذا ال patient criteria I am choosing to enroll patient تأخذ يعني تتشابه بها الكوفيد والإنفلونزا, then I will include probably I will not include I will not include some of the participants, وهذا هو sensitivity. بينما ال specificity ممكن I will exclude patients who are COVID. بكلتا الحالتين if you include patient اللي هم not COVID or exclude patients اللي هم COVID, then هذا will lead to selection bias. ولذلك ال definition is very important. دوما اكو يعني موضوع ينطرح academic definition and operational definition. هذا ممكن تسمعه. شنو ال academic definition؟ خلي نجي الى موضوع ال heart failure. If I raise a question, how you can define heart failure? Probably the answer, إذا بدنا نحكي academic, إنه the failing of heart to pump adequate blood comparing to the requirement. هذا هو التعريف الأكاديمي لعجز القلب. زين. How can you apply this definition on selecting patients with heart failure? Of course, it would be very difficult. فنعتمد على الاوبريشنال. مثلا اكو clinical criteria او ECG criteria و sometimes اكو combination of criteria. الهدف منها انه نخلي الديفينيشن well and clear. ولذلك دوما اكو نقول what are the good enrollment definition هو اللي يكون clear واضح reproducible. يعني if you are the examining patient and I will examine the same patient, we are going to reach to the similar conclusion. مو انت تقول عليه heart failure وانا اقول عليه مثلا pulmonary embolism. لازم نحط قواعد مشتركه ان يكون reproducible. كذلك concrete ما بي مجال للتغيير. of course scientific و cited. دوما يفضل من يقول اني depend on this definition اقول هذا الديفينيشن اخذته من وين. طبعا you are allowed in some cases to have your own definition. زين الاكسكلوجن كرايتيريا دوما الحقيقه ما كلش تنذكر بالريسيرش بروتوكول وحتى من تنكتب بالارتكل رغم اهميتها. I will have an example على الاكسكلوجن كرايتيريا and I will talk the example in Arabic. اذا نفترض انه احنا بدنا نسوي study على الاوتكم مال الكابج، عمليه واحده من العمليات اكيد المشهوره بالكارديولوجي، ونطلع المورتاليتي. فاذا احنا مثلا بالعراق نقول المورتاليتي ريت طلعت 5%، بينما نفرض في امريكا هي 7%. اذا ما نحط انه فواحد راح يسال هل من المعقول انه المورتاليتي ريت بالعراق يعني او الاوتكم احسن من الاوتكم في امريكا؟ هو ممكن صحيحه مو تزوير، بس شنو لما نعرف انه الاكسكلوجن كرايتيريا مثلا الستادي بالعراق مطلعين كل الناس اللي عندهم لو ايجكشن فراكشن، وبالتالي اللو ايجكشن فراكشن هو الفايتال في تحديد المورتاليتي. فاذا يصير منطقي انه من عرفت الاكسكلوجن كرايتيريا قدرت استنتج انه why the result is lower than that in other center. هذا الاكزامبل. ولذلك احنا من نحتاج نحط الاكسكلوجن كرايتيريا is to refine the research question. مثلا نضيق للريسيرش، بدل ما نحط الميل والفيميل نقول فقط I exclude female. To remove the effect of confounders مثل هسه المثال اللي حكيته، وهاي تذكرون حكينا عن confounders شلون نخلص منها. To enable interpreting the results. يعني sometimes if you have a result taken from يعني مثلا mortality rate of corona patients، اذا احط اللي عنده comorbidities واللي ما عنده راح النت result will be eaten from each side، بتكون compromised، ولذلك difficult to interpret. بينما من اقسمهم الناس اللي عندهم comorbidities عن الناس اللي ما عندهم comorbidities الريزلت تكون better interpreted. طبعا الجنراليزابيلتي حكيناها، امكانيه التعميم او التطبيق للريزلت on a large number of people in the community. يعني من نعرف انه هو exclude some of the criteria اللي هي ممكن تكون fit to my purpose or not. So in research protocol دوما لازم تنكتب الاكسكلوجن كرايتيريا وكلير ديفينيشن مالتها، وليش انت طلعت هذا. يعني تقول to decrease او to remove confounders او to prevent او to make the participant number اقل. In conclusion, for the first part, research protocol is a very fundamental part of conducting a research. Good research is starting with formulating a good research question. Hypothesis and objective should be written based on the research question. Choosing appropriate study design will guarantee its good results. لأنه تتفاجأ بعدين يقول لك هذا الديزاين is not enough to answer your research question، بمعنى إنه أكو خطأ على كل الستدي. الأخرى إنه carefully and accurately define inclusion criteria and exclusion criteria. Thank you very much.
Thank you so much, Doctor. So now if you have any question, you can raise your hand or you can write it in the chat and Dr. Shaka will answer you. There is a question, Doctor. Thank you, Doctor, for this comprehensive lecture. My question is, what kind of references are suitable to choose from?
يعني if I understand the references as the websites or the references from the website. If we are talking about where to search, فهنا راح تكون البابمد مثلا السكوبس important websites of important societies. اما اذا الريفرنس المقصود به هي studies، فاي study احنا we downloaded a study and we read a study نسوي لها الكريتيكال appraisal مثل ما راح ان شاء الله نشوف بالموديول الرابع and you can take it as a reference, supporting of course your research question. Any other
Thank you, dear
questions?
Doctor. It's clear.
May I have some comment, Mustafa?
Yes, Doctor. It's yours.
Thank you very much, Dr. Shakir, for this very interesting, simplified way of presenting research protocol and study. And I think our colleagues with us now should revise the slides again and see the recording, which is now is live streams on the page of the RCP London Iraq members and fellows page on the Facebook, as well as the YouTube channel, which is created specifically to include all these recordings. This is first. Second, Dr. Sahar, in the last presentation in the medical education course, presented very nicely how to do a research survey or review, research review. And I think, Shakir, we have to add another module to your course focusing on literature review. And we want to be as a practical one after finishing the 5 sessions of your course, 5 module, the 6th module to be on literature review, to be practiced within groups created on this Zoom, and step by step with guidance in order to enable our doctors and undergraduate students to practice literature review, which is a very important step in conducting a research. This is the second thing. And the third thing I want to announce that there is an initiative to do a research project. And this research project from the attendee of this course, headed by Dr. Sahar and Dr. Shakir. And let the participants in this initiative suggest a research question and research protocol and a study design, and it will be mentored by Shakir and Sahar step by step, and at the end we want this research to be published first in the Journal of Iraqi Ministry of Health, which is Dr. Shakir is the editor of it, and other by outside journals. I think we have, it is the time to be serious, to be hard worker, and to learn actively and to make use of these courses that the RCP London Iraq network is offering to our colleague. This is very important and unique chance for you, my dear undergraduate and newly graduated doctors. Kindly make maximum use of it. Thank you all for this very interesting session, Shakir.
Thank you, sir.
Thank you, Doctor. Thank you. Dr. Shaka, there is another question. There are many studies that are paid. How to know if it is worth buying?
Uh, what do you mean by paid?
I think he means that there,
Mustafa, please
Ask
ask
the,
him to
yeah,
unmute himself and ask the question
great.
directly, Mustafa.
okay, can you unmute yourself
أي
from
نعم نعم نعم. السلام عليكم.
وعليكم السلام ورحمة الله.
أي
Kindly
نعم.
present yourself, please.
نعم علي جعفر طالب مرحلة رابعة كلية طب بغداد.
أهلا وسهلا.
نعم. نعم سؤالي هو يعني من خلال الأبحاث اللي بالكلية مالتنا يخلونا نسويها يعني. Sorry, I should speak English. Okay. During our researches in college, we were asked to cite references from PubMed and other websites, but some of these research are paid. We should pay for them. They are not free, and many of them are costly. How to know if the study is worth buying? Worth paying for? Yes.
Good questions and difficult answer as well. Of course, it's difficult. يعني I am in Ministry of Health trying to do something just to raise the awareness of buying the licensee of important websites that can offer you the ability to go and to download for free good sources. Till now, there is no way, but hopefully I will keep digging in achieving this. However, if you, the best way I am using now is to ask the help from one of my colleagues outside to download the research that I may find of significance. Of course, it's difficult to say in advance that the article is going to be very good, but you have to try. You have to read many times in order to find which one deserves to be listed in your references.
Thank you.
May I add something, Dr. Shakir?
Yes, sir.
Thank you, Dr. Ali, for this very good question. I think as much as there is similarities or the required literature you want to buy it, answer the same question or very near to your question, I think this is worth one to see it. This is first. The second thing is that the number of citation for that article is very important. If the number of citation is large one, it means important an article and it's worth buy it. Thirdly, Shakir, why not we create a support, let's call it support site for any medical undergraduate students want to conduct a research, and he has a question in every bit of his study, like the study question, the study protocol, the type of the number of the sample, the type of the statistic to use, whatever. And also we can support buying some of the articles by funding from either Iraqi Red Crescent or other who can fund this project. We can think of that charter to support our undergraduates to do high quality, well-designed study.
Okay, sir.
If you
Thank
agree,
you so much.
Yeah, I totally agree, and we will discuss the issue to find the solution suitable for our.
Let's call it support center, support research center,
Yeah.
support research center.
Regarding technical supports, I raised the issue with Dr. Mustafa Ismail many times. I'm ready always in my workplace, the Center of the National Center for Training and Human Development, to receive any one of the candidates, anyone free to call me, and I will do my best to advise him about technical issues in writing a research protocol and conducting a research protocol and then writing a research protocol to be published in a medical journal.
Very good, Shakir.
but-
May it go directly to our target. Just create an email, including Dr. Sahar with you, and call it that is study research support. And we can announce it through our Facebook page of the RCP London. And anyone, any undergraduate or even postgraduate, want to any help in any way, we can deliver it. We will do it without any hesitation.
For the next issue of finding free download for articles, probably the protocols that are going to be written in our group, we have the ability to provide a free download from our colleagues supporting us.
Okay, thank you.
UK.
Thank you, Doctor. There is a raised hand here. Ari, you have the mic.
Yes. Hello, everyone. Thank you very much, dear doctors, for your great presentation. Regarding purchasing medical articles, I think there is no need to purchase any medical article, as I know a website in which you can add the link of the article you want to see, whether it is purchased or free, but main focus is on the paid ones. You can copy the link of the research article page and then paste it on that website, and you can have access to it freely. You can download it and you can do whatever you want to do with it. There's no need to buy any research article, because I have tried it many times that this website works great. I can share it with you on the chat section if you want it.
Thank you very much, Aaron. Thank you very much. Nice, very kind of you.
Yeah, probably, Dr. Ali, can you
you.
share this idea in the group between the candidates to make the benefit from this?
Thank you so much, Ari. We will share these ideas together. There is also another question. Is it better for the title to be more fitting our study? For example, you mentioned, is it to write the effectiveness of dexamethasone on the mortality of hospitalized patients?
The title is not necessarily to include anything, as the case in writing research question or research objective. You can write something, but the title chosen should be representative to the content of the research. And we will talk extensively about this when we come to the fifth module, when we are going to talk about how to formulate your title to be published in a medical journal.
Thank you, Doctor. If there is any question you can ask, because we have time, I think 4 minutes.
Okay, I have a question. I think the doctor referring to the website that can open any article, even the paid one. Sometimes this, I think the website called Science Hub, which is maybe a Russian website. It has some ethical problem. We put the ethical consideration in our and the research protocol, and also you have to state it in the when you are publishing. So everything like should be written, and this maybe create a problem for you, especially the ethical problem if you get the paid one freely. If you get a paid article freely, but this question is open for discussion also. So we have like 3 minutes. If you can go, Dr. Shakir, with that.
You are right, Mustafa. I don't know exactly the site Dr. Ari referring for, but we may discuss issue.
Thank you so much, Doctor. I think we don't have any question.
Okay, just one note, because have been said by people participating in the previous module. My picture appear through the account of Dr. Hilal Al-Safar. So the name of Dr. Hilal Al-Safar is with my picture. I am honored, of course, to have this name with me, but probably some of you have confused in last module. So I just want to say this. Thank you.
Thank you, Doctor. Of course, all of us know Dr. Hilal and you.
Thank you.
Okay, now time for a break, Mustafa.
Yes, Doctor. It's 10 minutes till 8 and 10 minutes.
So 10 past 9, we will have the
Yes.
second part of the session. Okay.
Yes.
Thank
You are
you.
now free to go and drink a coffee or tea, and we will wait for you at 10 past 9. See you there.
Shall we proceed to the second lecture about how to write a research protocol? Now we are in the step number 6, methodology, and we have talked about study design, choosing a study design, then defining the inclusion criteria. Then we talked about the third one will be in this, which is talking about sampling, randomization, and blinding. These important topics, of course, not seen or not necessarily present in all study design. For example, sampling we are not need to do sampling in case report or case series. Similarly, when we are talking about randomization and blinding, these two concepts are needed for randomized controlled trials only. نبدي بالsampling. Sampling is the systematic way we follow to get a sample for the study out of a targeted population. You may remember that we talked about the philosophy of research, where we are examining a few number of the population, targeted population, and then to apply the result on that population. So how we can choose this small number or the sample out of the targeted population? Good sampling aiming at minimizing selection bias and show representativeness. أن يكون الsample representative to the target population. ماذا يعني good sampling? Good sampling means that everyone fulfilling the inclusion criteria should have a chance to be selected. شنو التايب of samplings؟ In general تقسم ال types of sampling into probability sampling and non-probability sampling. The probability sampling where every element of the population has a probability of being selected in the sample. If this probability is not available, then it is not non-probability sampling. أكو أمثلة. طبعاً I'm not going also to go through these examples in details because I just want to show you what is sampling and why it is important to have good sampling. But probably in the future we may go through each one of them إذا صار عندنا مجال نسوي workshop. probability sampling, simple random sampling, systematic random sampling, stratified sampling, وcluster sampling. مثل ما تشوفون كلمة راندوم بالإحصاء لا تعني راندوم العشوائي باللغة. الراندوم هنا وفق قواعد. فمثلا السمبل راندوم سامبلينج أنا عندي 100 أسوي أكو ويب سايتس تو ميجر راندوم نمبرز، فناخذ هذه العشرة مثلا من 100 بشكل راندوم. سيستماتيك راندوم نرتبهم أبجديا، بعدين احنا نريد 10 من 100 نقسم 100 على 10 يطلع يعني 10. فالعاشر دوما نحسب 9 العاشر ناخذه، بعدين نحسب 9 العاشر ناخذه، وهكذا. هذا هو السيستماتيك راندوم سامبلينج. الستراتيفايد سامبلينج هو اذا قسمنا if we divide the group for example into male and female، وش قد نسبة الميل والفيميل باليوجوال population ناخذهم within the same، هذا يسموه stratified. الكلاستر اذا نريد نسوي مثلا nation wide study بالعراق هسه، نحاول ان ناخذ البوبوليشن مال كل محافظه وناخذ من عندها سامبل، هذا كلاستر يسموه. النون probability sampling اللي قلنا انه not every element has a probability to be selected. الاول هو الاكسيدنتال او الكونفينينت، و this type of sampling هو اكثر سامبل يستخدم بالعراق، لانه الحقيقه الطريقه الاولى البروبابيلتي تحتاج ريسورسز وتايم اند ماني. الكونفينينت من اسمه، يعني انا اريد اروح للمستشفى بذاك اليوم او للاي سي يو بالنسبه لمثالنا، اللي موجودين من المرضى راح اخذهم. بيربوسيف لما اكو فيتشر معينه اريدها تصير بالسامبل مالتي ممكن اخذها. كووتا سامبل من انطفت نسبه، الكوتا هاي اللي اصبحت شائعه، حتى احط نسبه معينه من الناس. يعني مثلا اريد سامبل من طلبه الكليه، واريد اخذ يعني مثلا اشوف their opinion about something. I include 10% quota from those juniors اللي هم الفيرست ستيج مثلا. السنوبول سامبلينج هي a way of using sample، هذه خصوصا بالدراسات الاجتماعيه اللي نعتمد بها when there is a stigma of labeling a person. For example, if you are living in a community and you want to do a study on, for example, those using heroin or any other addictive drugs. It's difficult, of course, even if you ask a person, are you addicted? He will say no. And this, if we catch one of those, ask him to bring his colleagues, and then colleagues to bring further colleagues. So they simulate them as a snowball sample. الخسارة اللي راح نخسرها لما نكون non-probability sampling, we will lose the effect of bias, because the effect of bias is high when we are using non-probability sampling comparing to probability sampling which has less bias. Example, define the population هم hospitalized patient ويا الكوفيد. Define the targeted population، ممكن نختار مستشفى أو أكثر اللي بيها hospitalization for COVID patient. الآن we apply the inclusion criteria اللي حددناها بالدefinition إلى الآن راح يصير عندنا تحديد منو اللي ينطبق عليه الكرايتيريا. الآن راح نسأل نفسنا سؤال: Are we going to include all those fulfilling the inclusion criteria؟ يعني كل مريض هو داخل مستشفى وعنده كورونا whatever النمبر راح آخذه، طبعا خلال الفترة اللي أدرس بيها، قد تكون أسبوع أسبوعين ثلاثة. إذا كان الأنسر yes I will include all participants، معناته there is no need for sampling لانه انت اخذت كل السامبلز التارجت. لما انا اريد جزء من التارجت بالتاكيد راح اريد اعرف الاكزامبل. If the answer is no, then I should write how I am going to take part of the population in my sample بالطرق اللي سمعتوهم قبل شوي. فmessages about sampling انه هو important way to minimize selection bias. Probability sampling is more representative to the population than non-probability sampling, but I cannot do it always because of limited resources, limited time, personnel. فمن أخذ أي طريقة أخرى I should write the way I am sampling for my study بالresearch protocol من أكتبه أو حتى later on من أكتب المقالة to be published in a medical journal. The randomization is the process of assigning patients by chance to groups that receive different treatments. أنتم تذكرون when we talked about I have two steps in any study خصوصا ال clinical trials. الستيب الأولى إنه أجيب ناس from outside the study into inside. هذا هو البوبوليشن. أختار السامبل مالته فأختار part of this population into the sample. الخطوة الأخرى when I divide my sample into different arms. مرات الستدي 2 arms مرات 3 arms أو حتى أكثر. فال process of selecting people from the population, selecting sample from population يسموها sampling. بينما allocation of participant من samples into either arm of my study نسميها randomization. الهدف من randomization is to avoid يسموه allocation bias. البايس اللي يصير within the study. عملية وضع هذا ال person in this group or that one. أذكركم مرة ثانية إنه randomization is very important concept. Why? Because it is the only process that we can eliminate the unknown confounders. قلنا أكو confounders known وهاي سهلة ممكن نتجاوزها by exclusion criteria مثلا. unknown confounders اللي difficult to be excluded because we don't know exactly what they are. So randomization can eliminate this effect. So according to this, randomized controlled trials have a higher level of evidence. So the randomization avoid allocation bias, confounders, especially the unknown. It has a higher level of evidence and should write in details the step of randomization. طبعا when we are going to talk about randomized clinical trials the third module, I will elaborate more about randomization. Blinding أيضا تسمى masking. The blinding is to hide the intervention used in each group from one or more individual involved in a clinical study. يعني الناس اللي هم يشتغلون بالدراسة أو الدراسة راح تطبق عليهم they not know exactly what is the intervention. منو اللي أنا ممكن أسوي له blinding؟ الparticipants. الكلينيشنز، الداتا كولكترز والاوتكم ادجوديكيترز، يعني المحللين او المقيمين لنتائج الدراسه، يعني اللي يقيس الافكت ليتر، والداتا انالايزرز اللي هم البايوستاتستيشنز. ليش هذه مهمه؟ Because there is a bias called performance bias during measurement. And this may affect the result. So if the person measuring the outcome not know which intervention was applied on this person or that one, we can eliminate the bias which may come through this way. بالblinding important to avoid performance أيضا يسمون measurement biases. Specify طبعا measurement biases مثلا في بعض الأحيان نسأل المريض هل هذا الدواء وخر ألم لو ما وخر ألم؟ فإحنا بالنتيجة كل المعلومة تؤسس إنه الدواء افكتيف لو لا يعتمد على المريض. فإذا المريض يعرف دواء وما كان يحبه ممكن ينطيك false interpretation. So if the patient cannot know exactly what was the treatment, then his answer may be more objective than being subjective. Specify who is or are being blinded. دوما احنا بالدراسات ولا زالت نستخدم single blind study, double blind, single blinded study, double blinded. الحقيقة recently لأنه عدد الناس اللي ممكن نسوي لهم blinding different مثل ما شفتوا, it is better to say who is going to be blinded in your study, the patient, the researcher, the biostatisticians, etc. It is not always easy to do blinding. يعني مثلا ننطي example الستادي. طبعا تريد تسوي دواء واني الريسيرشر, it is easy to make the capsule similar, one with the tested drugs, the other with the usual or even the placebo. And I cannot, I don't know exactly which one of them. But if I am the surgeon and I am assessing one intervention, surgical intervention, comparing to all other interventions, it's of course difficult to blind me. How you can do it? However, there are many tools that can help you to make it without any biases. طبعا we need to write in details من نكتب research protocol أو من نكتب article حول هذا الموضوع حتى to give an idea to people going to assess our results. فبالconclusion, the sampling, randomization وblinding, الsampling prevent biases before the study, عملية إدخال البيرسون إلى داخل الستادي. ومثالها to avoid selection bias. Randomization prevent biases during allocation of participants within the arms of the study, to avoid measurement bias أو allocation bias. بينما blinding prevent biases after allocation. يعني احنا ورا ما يصير allocation ونبدي الانترفنشن, then we will follow the patient after certain period of time to measure the outcome after having the exposure to the intervention. طبعا مثل ما قلنا هذا prevent performance bias or measurement bias. الجزء الآخر من الميثودولوجي أعتقد الرابع هو variables and outcomes. احنا دوما من نسوي دراسة يصير after doing a research we will have a large number of numbers. And we need to deal with these numbers in a proper way. In any study, we can group three types of variables. The first هي demographic factors, or أيضا ممكن نسميه baseline factors اللي هي demographic factors. The second هو outcomes. والoutcome مثل ما تشوفون, it is the tool to answer your research question. This is the most important part of your variables. طبعا we can add others if you find of importance to show the readers the other variables you've got. In our research question من حكينا على الدexamethasone, الoutcome مالتنا هو a little bit simple, is to measure mortality rate. Sometimes the outcome is very difficult, needs to be delineated, defined, how to measure it extensively. What are the types of the outcomes? Echo outcomes important for a clinician. Echo outcomes important for patients. Echo outcomes important for policy makers. Of course, I don't want to say that the outcome needed for a clinician is different always from that needed by patient or policymakers. Most of the time, the outcomes between these three parties are similar. However, when you raise something, you should think of the need of other party. For example, I am an orthopedic surgeon, and probably my best goal is to achieve reduction of the fracture to the best way. But probably the aim of the patient is to have less pain or any other. For example, some surgeries, the surgeon want to save the life, while if the patient, especially a woman, she may seek to be away from this figure, etc. So when you define the outcome, you should define the outcome suitable to all parties. What makes a good outcome? هذه الterms valid, reliable, responsive, and the clinical utility. Valid إنه يحقق الهدف اللي يريده. يعني I am testing drugs decreasing the weight. Now, what is the best outcome to show the effectiveness? Probably body weight or even body mass index. Reliable means if we do the test many times under the same circumstances, we will get the similar results. Responsiveness, إنه if a minimum change, I can detect this minimum change. A clinical utility, sometimes the outcome you measure, yes, it is good, but it is difficult to be applied on a patient. So I will get it, or it needs a very sophisticated education of people to do it. So this would be difficult to be used. The diagram shows you the difference between reliability and validity. Reliability, whenever we repeat an action, we come up with similar results, and not necessarily reliable is valid. لأنه الvalid achieving the target. مهم نكتب research protocol is to write the outcome extensively. First, to define what is the outcome. طبعا reference. Second, to define how to measure it. تذكرون من حكينا على ال DVT. If I define the outcome as occurrence of DVT or not, then I should write how I can measure DVT. Is it by clinical? And if is it on a clinical ground, what are the clinical features that make me suspicious of having DVT? If we are going to do by ultrasound, if we are going to do it through يعني Doppler ultrasound episode, what are the criteria of ultrasound that you label it as being positive for DVT, etc. So these things should be written extensively. Identify who will measure it. Of course, if you are doing Doppler ultrasound, you need to show that the ultrasound physician or radiologist is highly qualified, consultant, juniors, etc. Identify when to measure it, when applicable, of course. For example, if you apply بالexample مالتنا of using dexamethasone, I will give 1 month to test the effect of dexamethasone on mortality, because probably less than 1 month will show no much difference from the target. Probably I need to wait for 6 months to have the result. All these things should be written in the research protocol. Of course, we will talk about the type of variables and how to present it when we come to biostatistics next module. In our example, لازم نحدد إنه الoutcome مالتنا is the mortality rate, will be measured by measuring the number of died overall by 100, and the treating physician will determine the rate. at 30 days. Of course, المortality هو categorical variable and usually shown as percentages. Don't bother yourself with this paragraph because we will talk about types of variables and how to present them. الميثود other parts of methodology واللي هو أيضا very important parts ويمكن sometimes very difficult one هو analysis of data. Analysis of data is art of a presentation. I have so many numbers and I should show their effect in a simple way. من يساعدنا في هذا الموضوع؟ أول شيء how to show huge numbers in a few meaningful and understandable terms. هذا جزء من البايوستاتستكس اللي يسموه descriptive statistics. بينما to show that what you have got on a small sample is representative to the larger population هذا يسموه analytic biostatistics أو inferential biostatistics الاستنباطي أو الاستنتاجي. هذه الحقيقة هي الفائدة من الستاتستكس بالريسيرش. مقولة جدا أحبها إلى واحد من أهم الستاتستيشنز بالقرن العشرين هو السير رونالد فيشر. يقول to call in the statistician after the experiment is done may be no more than asking him to perform a post-mortem examination. He may be able to say what the experiment dies off. واضح جدا شنو المقصود. دوما احنا نقول you should consult the statistician before doing the research. حتى هو يحط لنا هوايه من الاشياء اللي نشوفها is difficult to be interpreted. Actually it is not our job. يعني even myself I find some difficulties to know every details of things related to statistics. So I should advise a biostatistician in advance and to put a plan with him to write the statistical tools and how to do it in the future after completing the examination. العرض analysis of data has three parts. الأول how to present the data. الثاني how to show the significance and size of outcome. والثالث how to show generalizability. I will come across these very rapidly because we will have a single lecture allocated for biostatistics in the next module. However, when اكو two types لازم نعرفها من variables اللي هي numericals numbers like for example body weight, height, blood pressure, and categorical groups male, female, mild, moderate, severe, etc. According to our understanding, whether the variable is in numerical or categorical, we can choose the best way to show the result. احنا بصورة عامة الطرق اللي عندنا يا اما mathematical, we use the mathematics to show the results, or tables or figures. هذا الدايجرام البسيط can explain this. Parametric و non-parametric هذا الكونسبت we are going to talk about it later on. I don't want to bother yourself. But in general, البارامتريك هي اللي تحترم إذا سامعين normal distribution curve. If a variable follows the normal distribution curve, then it is parametric. If it is not, يسموه non-parametric. على العموم احنا بالبارامتريك المين هو المهم with standard deviation. بينما بالنون بارامتريك الماثماتكس نستخدم الميديان ويا شيء اسمه interquartile range أو ratio. Of course, you don't need to know every details of these because this is a job of biostatistician. Can help you a lot. طبعا الفيجرز من خلال هيستوغرام والمثال واضح مثلا الهايت والشوجر والى اخره. بينما الكوانتيتيف الكاتيجوريكال عندنا ريشيو هل get percent male هل get female، ونقدر نعرضها بطريقة البار chart مثل ما تشوفون بالدايجرامز دوما اللي موجودة بالستاديز. الآن شلون نشوف significance of data؟ احنا يا اما we want to measure risk association، يمكن شوية بدأت تصعب القضية بس I'll touch it now. بس اريدكم تاخذون فكره انه هذه الاشياء اللي ممكن تصير، لانه the process of biostatistical analysis is the job of biostatistician. You need to know the broad meaning of the terms, not the details. To measure the risk of association عادة نستخدم الاكسبيرمنتال والكوهورت ديزاين. إذا categorical data مثل المورتاليتي ريت نستخدم الريسك ريشيو اودز ريشيو. إذا numerical يعني أطوال وأوزان نستخدم الديفرنس in means. To measure association الدراسات عادة المفيدة هي الكروس سكشنال والكيس كنترول، ونقيس بها الكوريليشن ريجريشن والاودز ريشيو. طبعا بنريد ناخذ تيست دايجنوستيك تيست الكروس سكشنال هي المهمه، نقيس بها sensitivity specificity and negative and positive predictive value. Don't be afraid from these things. I just want to show them for you, and as I told you, this is the job of a biostatistician. And of course, if any one of you have an interest with biostatistics, he can go and read more resources, and I am ready to help. الآن how to show significance and generalizability تتذكرون هي بطريقين بدون ما دخلكم في تفاصيلها، من خلال قياس ال p-value. If the p-value is more than 0.05 then statistically this is not significant، والديفرنس اللي طلع لنا بالدراسة is due to chance. If the p-value is equal or less than 0.05 then this means that the result is statistically significant, where it is not due to chance but due to a real difference. هذا بالنسبة لل p-value. Confidence interval هذا الترم المهم. We are going to talk about it later on. هو range of values that probably contain the true value of the population. طبعا شلون يحسبوه؟ يحسبوه من خلال معادلات خاصة based on the results of the study. So with any study, whenever it is relevant, we should measure the p-value and confidence interval. البروسيجر المقصود بها الحقيقة هي البروسيجر مال البحث، not the surgery or other things. يعني for example, we include هل قد number of patients 100 were included in group A, another 100 in group B, the first 100 we do such and such. Other group B, we do another intervention, we measure the outcome, etc. We نلخص البروسيجر مال البحث. Ethical consideration is very important to be written in a research protocol. احنا حاليا انا member من الكوميتي اللي تدرس الريسيرش بروتوكول. Anyone want to do a research in institutes of Ministry of Health provide his research protocol, and we will study the research protocol, specifically the ethical consideration. Ethical consideration مهمة. What is the type of consent؟ تعرفوها استمارة الموافقة على المشاركة في بحث consent form. Is it written or verbal؟ طبعا some studies need written اللي هي intervention، بينما studies اللي there is no intervention verbal is enough. content of consent you should write in the consent، وحتى تخلي يعني نموذج. we include a form of the content of the consent اللي تشوف به انه المريض كان حر في او الشخص حر في he is free to accept or refuse to participate. How you are going to deal with the participant when a complication developed, etc. of these things. Approval of the owner of data. If you want to have a study on data and this data belong to a hospital, then you have to take a preliminary acceptance from the hospital administration about using the data in your research. Of course, how to deal with data, very important. You should state that the data will be confidential and will not be used except for the purpose of the purpose of the study. The last point in our last step in writing a research protocol is the resources. دوما الريسورسز human, economic, time. فويا كل study we should make a teamwork and we allocate each person his job to do. And sometimes we need to train our participants within the team about the job he is going to do. ويمكن if we proceed to do the initiative raised by Dr. Hilal, we will we will teach you how to build a research team and how to allocate jobs within its member. The financial, define the money you need. You should have a plan about all the money you want to or in need. Of course, sometimes you are using or calculating the direct cost. No, you should write all money. حتى الأوراق اللي راح تنطبع، عملية النقل إلى آخره. Second is to search for a funder. It is, as I told you before, it is not the easy job, not only in Iraq. In Iraq, we may find difficulty in finding somebody supporting us. It is also a problem outside. And it is the job of the researcher to find and convince a funder to pay money. أكو governmental finding مؤسسات ودول، أكو professional societies أيضا ممكن توفر لنا funds، أكو institutional أيضا departmental and industry. كليتها الحقيقة يعني جهات ممكن. Even in Iraq, if we able to do or to write a research protocol that convince others, it is a very important subject, it deserves to be applied, you can find a funder for your research. أكو ورش عمل, workshops and training courses about how to get a fund for your research. طبعا الفقراء المساكين بالعراق عادة هم self funder الريسيرشر. التايم لاين هذه مصطلح أرجو أنه تحفظوه مثل ما تشوفون. تتخلى الأشهر والسنوات، طبعا إذا البحث يطول سنوات في بعض الأحيان، ونبدي من البلاننج، نقول خلال أول شهرين إحنا البلاننج، الريجستريشن بالشهر الثالث، الانرولمنت نبدي من الشهر الرابع، وهكذا بالنسبة للأذر. آخر شيء رايتنج أدرافت نكتبه بعد كذا شهر. يفترض أيضا إحنا you can write in details your timeline of a study. هذا يعلمنا الحقيقة إنه نهتم بالresources. Resources very important. يمكن essential part لأنه it's difficult to do a research without paying attention to the resources needed. اللي يصير احنا بس ملاحظه يعني قبل الكونكلوجن الختامي، انه في بعض الاحيان حتى نتجنب نسوي دراسات كبيره ومهمه خوفا من تكاليفها، نسوي دراسات قد تكون هامشيه او its effect on the usual practice is very limited. So we should teach ourselves about how to write a proposal for a research, a good research, and we should teach us to calculate the resources needed and how to convince others to support us financially. The conclusion of part 2, whenever relevant, care should be paid for sampling, randomization, and the blinding. لأنه very important. We have to choose a good outcome to answer our research question, and we have to show the statistical tools going to be used in the research. We should pay a considerable attention to the ethical consideration in any research, and we should not forget that a research is a time, effort, and money. And thank you very much.
Thank you so much, Doctor. Now, if anyone has a question, you can ask in the chat or you can raise your hand.
دكتور مصطفى أنا عندي تعليق.
نعم دكتور تفضل.
Thank you very much, Dr. Shaker, for this very informative information and simplified in a way to be practically useful for all colleagues. One important point is that can you design a homework for the attendee to do it before the next session? That's to say 2 weeks from now till you present the section 3 of your course. Like anyone who is attending the current meeting to write a research title and research question and a study design and the way of sampling, and then to be reviewed by you and the committee with you, Mustafa Abbas, Mustafa Ismail, and the other, and the research team before the coming section. Dr. Shakir?
Yes, sure. Yes, sir. This is very logic way to understand that the
yes.
participants
to apply the data. This
yes.
is very important to apply the data you have just presented. Yes.
Yeah. I just add something. I want them to group themselves into 4 or 5 persons per group, and to present a single protocol. This will help them to work as a team, a single team, and probably will give them a chance to present their research protocol, and we and others listen to say our comments and questions.
Yes. This is very important. That is learning by doing, because just watching a presentation is very useful. Definitely, it will add to our data. But practicing and applying what we have learned is very important to improve our learning. And I think this is important. So may I call Dr. Mustafa Abbas, Mustafa Ismail, to categorize the attendee into groups, and then Dr. Shakir will send a task for them to be presented, and then probably we will have another meeting in between the courses just to discuss, and each group will present their data, the research title, the research protocol, the research question, etc. Is that okay, Shakir, Mustafa Ismail, Mustafa Abbas?
Yes, doctor, it's clear.
Okay.
Yes, I also I want to add one point. If there will be a competition, and I will link it to your previous idea, Dr. Hilal, which is to choose the best 2 presentation we do it like, and we proceed with the protocol to an actual research. So this is will be the best thing to go forward, I think. But also
Okay.
we have to discuss it later.
Okay. The second point I want to focus here, the Royal College of Physicians in London is very focusing on our activity, and really they are very proud of our work. And in the mid of July this month, an article will be published in the commentary magazine of the Royal College. This is a very highly respectable journals of the Royal College of London, talking about our initiatives and our undergraduates and other our newly graduated doctor effort. So they are very focusing on that. So if we came out of this course by a research, one or more, done by medical student, it can be presented in any conference in UK under the umbrella of the RCP London Iraq members and fellows network. The third thing I want to talk about is that we are doing a parallel course in medical education. An alternate, this Friday is research course. Coming Friday is the medical education, Friday and Saturday, 2 days, medical education course. These two courses are very linked together because in the next module, module 2 of the medical education, we three presenters, very distinguished presenters, one from Oxford University, and one from Leicester University, and one from Johannesburg University, will present very important concept, very useful to undergraduate students. And that include the learning style versus, deep versus shallow learning, and how to do a course, how to design a course, how to put in objectives, how to do alignment between the course objectives and the teaching methods and the assessment, which is very important for you as an undergraduate to understand, because you are the leaders of the future. You have to be on a solid base, solid foundation. We try to create some baseline for you for the future. So kindly attend both courses because they are linked together, and at the end you will observe the huge learning size you will get it at the end of two courses. Thank you very much.
Thank you, Dr.
Thank you,
Bilal.
doctor.
Any other question?
There is no question, I think, doctor.
Thank you very much for you, Mustafa, and for all the participants in this module. See you in the next module, inshallah.
Thank you, Dr. Shaker. Now the final thing is you have the feedback form. Now you can copy it, and for you, or you can wait, and we can wait also like to fill it. It takes less than 1 minute, even seconds to fill, and this will show your attendees to this session.
There is a question. May I answer, Mustafa Ismail? There is a question from Ali
Okay.
Amili. He is asking, are the videos for the medical education course available on YouTube? Yes. Kindly, Mustafa Abbas or Ismail, share the link of the video YouTube channel on which the medical education course videos are uploaded, as well as Dr. Ali Al-Amili. These videos are also uploaded on the Facebook page of RCP London Iraq Members and Fellows Network. So there are two sources. One of them is on the Facebook page and the other one on the YouTube channel. Very important, it's very important because the next second, the second module, which is on coming Friday, it needs a certain survey to be done on the learning style. Very important, every one of us to know what is his or her learning style, because this will will help him to learn better, to get the information better, to do better. If you know what is your learning style, some people are usually learn by doing, others learn by seeing, others by discussing, etc. So if you want to know what is your learning style, Omnia will send the survey sent from Leicester University to every participant in the coming module to know what is or her learning style. There is also a question from Navar Burhan. I have applied for the medical education course but not received any response. I think I didn't get accepted. Navar, kindly send an email. Mustafa, send the email of the group. The email, send it to please anyone who wants to register on the medical education course, he can do it. Please send or put the email of RCP London in the chat bar so that they can contact you. Mustafa,
Yes, doctor, I will write it right now.
please, anyone from the attendee who having the chance previously to join our medical education course can kindly send an email to the email which will you see it very soon. This is the YouTube channel. You can see the YouTube channel on all the videos of our activity are uploaded there, and including the discussion and including the PowerPoint presentation if you want to review it. And also the email will be sent to you, and we can accept anyone who is enthusiastic and he is eager to learn. There is another question from Hawazin Jauhar. Is there is another section of module 2 tomorrow to know? The research module presented by Dr. Shaker is only on a Friday, single day. But the medical education course, because there is a wide area of want to be covered, it is on Fridays and Saturday. You can see now the email account in the chat bar. That is RCP London Iraq Network at gmail.com. You can write if you want to join the medical education course on that email and consider it is done. Any other question or comment or suggestions? Very welcomed.
Thank you, doctor. And Omnia is saying don't miss the medical education module next Friday. Of course, we will not.
I am just talking. صار لي ساعة أحكي عليه أمنية.
Omnia came late, doctor.
Okay, most welcome. Really, you are the leader of Iraq. You are the leader. We believe that. We want to prepare everything good for you. Be aware that at our ages, no one prepares such activity to us. So kindly make use of this activity as much as you can. There is a very nice phrase saying that behave like a sponge, absorb the chance completely. So do it like that.
It's a greater phrase. I'm like, we must do it always. Thank you, Dr. Hilal.
Thank you all. Thank you for your effort. Mustafa Ismail, Mustafa
Thank
Abbas,
you.
thank you, Shaker. Waiting for the third session 2 weeks from now. Thank you very much.
Thank you.
Thank you very much, and hope to see you next Friday in medical education module. And I hope that all of you were following the assessment form that Mustafa has sent you in the chat. And wish to see you in the next module. Thank you so much.
Thank you. Have a good day.
Thank you. شكرا جزيلا.
Have a good day. Goodbye.
مع السلامة.